Imagine this. You're looking at an ECG in a busy emergency room. Something feels off. The rhythm looks fast, unusual, and then you spot it, a small slurred bump at the beginning of the QRS complex. If you recognize it, you may have just prevented a life-threatening arrhythmia. If you miss it, the results can be catastrophic. Welcome back to the Daily Cardiology. Today we're exploring one of the most iconic ECG diagnoses, Wolff-Parkinson-White syndrome, or WPW. This condition was first described in 1930 by three brilliant physicians: Louis Wolff, an American cardiologist; John Parkinson, a British cardiologist; Paul Dudley White, a renowned American physician and one of the founders of preventive cardiology. Together, their work identified a pattern of short PR intervals, wide QRS complexes, and paroxysmal tachycardias, which later became known as Wolff-Parkinson-White syndrome. WPW is caused by a congenital accessory pathway, an electrical shortcut that should not exist in a normal heart. This pathway, known as the bundle of Kent, allows electrical impulses to travel directly from the atria to the ventricles, bypassing the AV node entirely. Normally, the AV node acts as a gatekeeper, slowing electrical conduction just enough to protect the ventricles. But WPW ignores the rules. It takes the shortcut. This can lead to dangerous arrhythmias and, in rare cases, sudden cardiac death. Because electrical impulses can travel through two routes. One, the normal pathway, SA node to AV node to ventricles. Two, the accessory pathway, atria to ventricles directly. When these pathways fire in an unfortunate sequence, they can form a circular electrical loop. This leads to atrioventricular reentrant tachycardia, AVRT, a sudden, rapid heart rhythm that can reach extremely high rates. 1. Shortened PR interval. Since impulses bypass the AV node, there is no normal delay, making the PR interval shorter than usual. 2. Delta wave. This is the hallmark finding, a slurred, upsloping beginning of the QRS complex, caused by early ventricular activation through the accessory pathway. 3. Widened QRS complex. Because part of the ventricles depolarize early and the rest depolarize normally afterward, the QRS becomes widened, a fusion of two activation sequences. These three findings together create the unmistakable ECG profile first described by Wolff, Parkinson, and White nearly a century ago, and still vital for every clinician to recognize today. WPW is one of the most striking ECG diagnoses, but also one of the most dangerous if missed. The good news? Once you understand the shortcut pathway and the delta wave, it becomes easy to spot. Want a video explaining AVRT mechanisms with animations and examples? Let me know in the comments. And subscribe to Daily Cardiology for more insightful medical knowledge.